Good afternoon and welcome to another edition of The Doctor Is In, brought to you by Bay Area Medical Center. I'm Jim Callow, your host, and today our guest is Kate Laurin, who is the Director of OB and Gynecology at Bay Area Medical Center. She's an RN and has been at Bay Area for over 15 years. She got her nursing degree from Bay Community College and is currently completing her master's in nursing at Walden University. She holds certifications in basic life support, advanced cardiac life support, pediatric advanced life support, and neonatal resuscitation. She's a member of the Wisconsin Association for Perinatal Care and the Association of Women's Health, Obstetric, and Neonatal Nurses. That's a mouthful.
Yes.
Welcome to the show.
Thank you.
All right, we're going to talk about OB, and let's talk about it from the beginning. Once a woman finds out she's pregnant, what are some of the things she should do to assure she's got proper prenatal care?
Sure. So one of the first things that moms should do is they should choose a provider. And they can do this by talking with family and friends, talking with their primary care provider, and attending or going to a local clinic in the area. It's also important for moms to check with their insurance companies to see who is an in-network provider that may help guide her care. Additionally, when a mom finds out she's pregnant, usually feeding choices are decided upon early in pregnancy. So moms can make an appointment with a lactation specialist at Bay Area, and we can help with some of those decisions as well. But they can also go to our website at BAMC.org or our Facebook page.
And there's information there as well.
Yes.
So. All right, so of course you're going to be working closely with your OB doctor, and a lot of good information comes from them as well.
Yes, absolutely.
All right, so Bay Area does offer some prenatal classes. Tell us about those.
So our prenatal classes are a series of 4. They are offered to anyone, regardless of where they deliver. They're free of charge, and they cover labor and delivery, the postpartum period, baby care, and breastfeeding. Our breastfeeding classes are taught by our certified lactation specialist, and she really gets women comfortable with breastfeeding and knowing the nutritional benefits of breastfeeding. All classes will prepare families to take care of themselves during their labor process, also making sure that they're comfortable going home with baby, and making sure they know the safety tips, feeding and sleep and hygiene, and how to take care of baby.
All right, where in the pregnancy do you recommend the classes be taken?
Classes can be taken anytime during pregnancy. We often suggest that they take them around 4 to 6 months gestation.
All right. Well, let's talk a little bit about what happens when you come in for delivery at Bay Area Medical Center.
Sure. So patients will experience individualized one-on-one nursing care. We have a highly trained team of nurses with over 300 years experience combined. We also have lactation specialists that are there to help our moms with breastfeeding. Once baby is delivered, moms and babies room in together, and this helps mom get to know baby and baby to get to know mom, and for moms to recognize the early feeding cues and to develop a routine before they go home. So along with breastfeeding, our nurses work closely with our patients so they're comfortable leaving the hospital knowing how to completely take care of themselves and their babies when going home. And each room is private, and the family can stay there during their stay.
All right, how long do they normally stay?
Usually 2 days.
Okay.
So we like to discharge on the day of discharge before lunchtime.
All right. I hear there's a good meal involved.
There is. So each delivering family receives a special meal that has a very special entree. The presentation of the meal is beautiful. There's linens, there's wine glasses, and it's just a very nice touch.
I've heard good things about that.
Okay.
All right, let's talk about some of the things that you do to offer moms a little bit easier birthing process.
So there's a lot of different moms that want different things, so we need to be very good at multiple things. So we need to offer support for moms that want to want to have a natural labor, and we need to be able to provide support to those who would like something for pain. So some of the things that we try to do is for natural labor is we began offering aromatherapy for our patients, and that helps patients, on all levels, mentally, physically, emotionally. We use high quality essential oils to promote a good calming environment that can help moms get through their labor. We have medical pain management options as well, including epidurals during labor. And then we also offer ambulatory fetal monitoring options, so moms can be up and walking around during labor. And we use birthing balls and squatting bars and peanut balls, all things to kind of facilitate the labor process.
Okay, a lot of options available.
Yes.
And every mom's a little bit different, I'm sure.
Yes.
Yes. All right. Unfortunately, we sometimes hear that babies are in need of a neonatal intensive care unit after they're born. How does Bay Area handle that kind of situation?
So we work very closely with area NICUs when there is a baby that needs a NICU. And sometimes we're able to even coordinate care if we know a patient will need a NICU. We can coordinate with the team and they will come for delivery. So that helps us to provide the most optimal care for that baby. In addition, our nurses are all certified in neonatal resuscitation and stable, which is stabilizing the infant prior to a transfer to a higher level of care. And so our nurses are highly trained at stabilizing a baby before they would need to be transferred.
So you're all set, you're trained up and ready to go.
Yes.
All right. Let's talk about skin-to-skin contact. How does that encourage bonding early on?
Sure. So skin-to-skin contact is when the baby is placed on mom's chest, skin-to-skin after delivery. This helps newborns transition into life outside of mom. It also helps them to regulate their body temperature, and it's beneficial for the bonding and early initiation of breastfeeding, and it helps mom to produce milk faster. So it's all very, very good things.
Good. All right, we're talking to Kate Laurin, who's the Director of OB at Bay Area Medical Center, and a lot of folks have had some contact with the current OB unit at the present hospital, but if you're just finding out you're pregnant now, chances are you're going to be delivering at the new medical center out on University, and that's opening in August of 2018, so
yes.
That's going to be a lot of fun, isn't it?
Yes, it's going to be great. Our new rooms are going to be very large and spacious, and they'll have modern conveniences of home. They will have refrigerators, microwaves, large screen TVs, furniture to accommodate guests, large cots for dads. They will have beautiful views of the nature. Our bathrooms, I think, are going to be great. They have spa-like showers with multiple jetted shower heads, and it just provides moms with a special relaxation and comfort options while she's with us. Patients will have labor and deliver and go through the postpartum periods in their room, and everyone will stay right in that room. And we'll have an in-unit C-section suite, which is something we currently don't have, so lots of great things to look forward to.
Okay, I know that a lot of thought went into planning that, and I understand the staff had a lot to do with how it's laid out.
Yes, so all of the team participated in kind of the design and the flow of our unit, and we took a look at it from a patient-centric standpoint, and so really making it convenient for the patient, what the patient would want to see and expect, and they helped with the flow, the furniture, and just the layout of the space. We had mock-up rooms put up in a warehouse in town, so the staff were able to go in. We were able to see, what's going to work, what's not going to work, does this need to be moved. So everyone has participated in this, and it's, going to be really special.
I had a tour of the hospital about a month ago, and I was standing in the middle of one of the new rooms. Wasn't much there yet at that time anyway. The sprinkler heads were there, and that's some piping, and that was about it. But I was certainly impressed about how large the room is.
The rooms are very large. I think you could probably fit 3 parked cars in there, plus some extra space. So
A little bit, and there's 5 of those suites that will be available.
yes, there's 5 labor and delivery suites and 2 spacious postpartum rooms, and we will also have a triage and testing room. So moms who come in that might have a concern that maybe they're in labor or in early labor and just want to get checked out and reassured, will have a short stay room where she can come in and get checked out within the department.
Wonderful, because
Yeah.
I know a lot of moms-to-be aren't sure whether it's time or not, but now there's a place to go.
Yes.
Excellent. So how can expectant mothers learn more about what you do and what you'll be doing at Bay Area?
Sure. So patients can visit our website at bamc.org. They can call the department to speak with a lactation specialist or to register for classes or even a tour. Brochures for prenatal classes are located in the hospital entrances, and information can be found online or on our Facebook page.
Okay. And before the new hospital opens up, they'll be conducting tours, I think, in July and into August, and so you'll have a chance to check it out before it actually goes into use.
Yes, I'm excited to get over there. So when they have an open house, I definitely welcome members of the community to come in and check it out. It's going to be a great place, and we're extremely lucky to be having a new facility in our community. So.
Indeed. Well, we want to thank you for being with us. Kate Laurin is the Director of OB at Bay Area Medical Center, and doing a fine job where she is, and looking forward to that new medical center coming in August.
Yes.
So thanks for being with us on The Doctor Is In, the program brought to you by Bay Area Medical Center. I'm Jim Callow. Have a good afternoon.